Chodak. I'm a clinical dietitian with UR Medicine, Center for Community Health and Prevention, and I'm here to talk to you about dietary supplements. So it's fall, it's back to school, it's flu, COVID, cold, all the things season. And so commonly what I hear in my clinic is, oh, I need to start taking vitamin C, zinc, and vitamin D. And while this seems to be a good move, sometimes it's not. And so I find that running through a list of questions to see if these things can actually help you versus harm you is really important to getting the best care and living your best life and your best health throughout the holidays and all the coldness that's coming. So the first question I would ask myself if I'm considering a dietary supplement is, can it harm me? And believe it or not, some can. And so when we think about vitamin C, okay, so let's talk about that because that's the most common one. The recommended dietary allowance, the amount that governing bodies and scientists suggest you take or get from your food per day, so that's the RDA for people 19 years old and above. For men, it's 90 milligrams. For women, it's 75 milligrams, okay? So that's about how much you're supposed to be getting from your food. When you look at supplements on the shelves, you see higher dosages, right? And so too much of a good thing isn't always good. And so there's this thing called the UL, which is the level of toxicity, and some dietary supplements or nutrients have those. Vitamin C is included. And while it's typically not super reactive and toxic, when you take bigger dosages, it can have negative effects, which you're trying to avoid and prevent, right, when you take it? And so the UL, or level of toxicity for vitamin C per day, is 2,000 milligrams. And I commonly see people taking way more than this per day because they think they're trying to do good, right? And so let's not cause more harm than good. And so some of the symptoms that you might see if you take too much vitamin C are GI distress and kidney stones. Not fun. So the moral of the story is that too much vitamin C can actually harm you. So that would be the answer to that question, okay? For zinc, same deal. We want to consider, okay, if we're trying to amp up our immunity, we don't want to cause more problems. Well, the RDA, the recommended daily allowance for zinc for men is 11 milligrams and for women is 8 milligrams. Again, think about what you see on the shelves. You're seeing usually about 50 milligrams per tab per day, right? That's above the level of toxicity. The UL, the level of toxicity for zinc, is 40 milligrams. So with prolonged exposure to higher levels of zinc than you need from a supplement, not from food, but from a supplement, can actually cause harm for sure. So it, again, can cause GI distress. It can actually cause you to lose your appetite. And it can also interfere with copper and magnesium absorption, which can cause all sorts of problems and decrease your immunity. So it kind of can work against you. So the moral of this story is, this one can cause harm too. So we want to consult a dietitian like myself or your healthcare team to make sure before you start taking these things that it's right for you and it can't cause harm. The third one I'll talk about is vitamin D. So the recommended daily allowance for this is 600 IU, international units. And the level of toxicity is 4,000 IU. Right? And so when we think about the sun going away and immunity, we think, oh, we need vitamin D. Well, it's not quite that simple. And if you take over 4,000 IU per day and you don't need it, it can cause harm too. It can cause GI distress. It can cause kidney stones. It can cause extra calcium floating around in your blood, in your urine, all the things. And so you don't want to play around with this or guess. Again, going back to get a dietitian, make sure it can't cause harm to you if you're going to take it. And if you're unsure, well, think about two other questions that I have. Can it help you? Can it help me? Well, if it can, then I want to talk to my medical team to make sure I don't do harm. And then the next question that I would suggest you ask is, are there any alternatives? So if I'm looking to boost my immunity, maybe instead of supplements, I add a little bit of walking. Maybe I add a little bit of fiber. Maybe if I'm trying to add vitamin C to my eating pattern, maybe I have more fresh oranges or orange juice. A lot of considerations here, and it's important that you know them so that you're not going into this fall season adding supplements that could harm you. Thanks for listening, and there's more information on the National Institute of Health Office of Dietary Supplements. So it's the National Institutes of Health Office of Dietary Supplements, that website. And then also you can always contact our office or one of our dietitians for further support. Thanks so much.